What I talked to the Williamson Group about was being the Chief Executive of Southern Health, having a budget of $1.2 billion, and then talking about the wider health needs of people, the wider global economy, the local economy, and thinking about how we're actually going to make healthcare sustainable for the future. How we're going to reshape the future, how we're going to ensure that as populations grow, as we continue to get more diversity within our populations, how we can ensure that our health services actually are still there, are sustainable for the future and can deliver that care back to people as they need it. So people are living longer, which is fantastic, but we want people to be healthier if they're living longer as well. And what we're finding is that as more and more people are older, number one, there's less people that are there then able to care for people because the whole profile of the population changes. We're finding that more and more aged care, chronic illnesses are happening, so people's care is getting more complex. They no longer come in with just one type of illness, they've got a whole lot of comorbidities with them as well. And so what we're finding is that people are needing a lot more care as they get older, they're living longer, and also society is pushing back on what was traditional care and are wanting quite different care and quite involvement in their care as they're getting older. And I think that's a really, really good thing, but it actually challenges us to reshape the way that we deliver care back to those people. Yeah, I have a real passion that I think that we need to reshape healthcare to actually acknowledge that every patient has a bed of choice and that is their bed at home. So what we, I think, should be doing is looking as much as possible as to how we can get people back into their beds at home as soon as possible and making sure that we actually wrap healthcare around them and make it a lot more facilitating for them to be at home. So, you know, we all love our own beds and that should actually be our philosophy as we go forward and plan for healthcare. So I think leadership is about a whole lot of things. It's about visibility, it's about courage, it's about resilience, it's about how we frame things and how we communicate to each other. It's about how we ensure that everyone is aware of what the goals are, but it's also around ensuring that we have fellowship so that people actually follow us in what we do, because without having people following, you wouldn't have leadership. So it's about how we create that burning passion in people for them to follow the lines of direction that we're actually wanting to move in. I love talking to the Williamson Group. We get such fantastic questioning back. It's a great way to have and widen some of our healthcare knowledge, understanding and debates. And it's just something that I feel incredibly passionate about. I think investment in leadership and development of leaders as we go forward is something that we should all be spending more and more time with, and I congratulate Williamson for having the fine program that they do. We've now had 5 of our staff through Williamson leadership programs and we can see a difference in each and every one of them. So thank you.